Joining us right now to weigh in is family and emergency medical doctor, City MD Director, Dr. Janette Nesheiwat. Dr. Janette Nesheiwat, good to see you. Thanks so much for joining us. Your thoughts on pre-existing conditions as the battle continues this morning.
So this is a big game changer. Lots of negotiations going on, and it's moving in the right direction, which I'm very excited about. And patients should be very happy about that as well. As far as with pre-existing conditions, look, President Trump promised that it would be covered in the new bill. And rightfully so. You can't control if you're born with one kidney or a congenital bone disorder. But, on the other hand, I do think patients should be held accountable for their actions. For example, if you smoke, if you drink, if you're obese, if you're overweight and you're not taking care of yourself due to willful neglect, that's another situation that needs to be looked at. But overall, pre-existing conditions, that's just the card that you're dealt with. If you're born with a medical condition, we've got to help each other out. We've got to serve, humanity and cover those people who are already covered. We can't just discontinue that.
The central issue is not with the Republicans making changes to this bill, is not whether you will be covered if you have a pre-existing condition. It's who's going to pay for it. That's the central issue. Is it going to be embedded in the health insurance and the cost of everyone and in the premiums, or will it be handled through high-risk pools? I just wonder, in the latest version of this health care bill, the centrists don't like it. It keeps the regulations, guaranteed issue and community rating are the issues. But the states can apply for a federal waiver if they pursue other measures. And the states can receive a waiver if they avail themselves of the bill's $100 billion fund to set up for high-risk pools. This is in the Wall Street Journal yesterday. It's just how they handle it. And I swear that Jimmy Kimmel going on late-night TV and talking about his infant son with a congenital heart defect is going to move some of these centrist Republicans. It's a very sad story, but it has nothing to do with what's going on in Washington.
Go ahead. I was going to say, Dagan, you asked who's going to pay for all these pre-existing conditions. Well, thanks to the MacArthur amendments, they're going to allow states to have more flexibility with the essential health benefits, which is a very smart move. Because remember, what are the essential health benefits? The 10 of them: maternity care, pediatric care, lab services, trips to the ER, trips to your doctor's offices. Well, guess what? A 22-year-old male college athlete doesn't need maternity care. So that's going to save money and hopefully reduce costs and allow everyone to have those pre-existing
Well, I can tell you who's going to pay, and it's the overall consumers. If we look at the most recent economic reports, we can see that healthcare costs are rising precipitously year over year. This latest read gave us 17.3% of consumer spending is on healthcare. So overall, the entire country is going to pay for it, and it keeps coming up. And that's from a 13.5% reading back in 2001.
Well, all I can tell you is, I've been a doctor and I've gone through medical training and medical residency for 15 years. All I want to do is take good care of my patients, but it's hard to do because of the financial burden that's put on them and the inflammatory administrative, constraints imposed upon us by the government, by Washington, and by insurance companies.
One of the country's largest insurers, Aetna, says it's going to scale back its participation in the Affordable Care Act exchanges again. They're going to scale back in 2018. They're citing this projected losses. These insurance companies are losing money left and right. The decision coming 3 months after Humana announced it was withdrawn completely from the exchanges. Part of it is insurers weighing uncertainty out of Washington. Why would an insurance, if it doesn't cover pre-existing conditions, why would an insurer, cover knowing that the person has this pre-existing condition? In other words, if it's not involved, what happens to the insurance industry?
Well, the reality is that pre-existing conditions would be totally covered under this bill. They are presently. Dagan is absolutely right. Do you want this sort of hidden in rising premiums for the individual market? Do you want states to be spreading the costs out a little bit more using a high-risk pool, which seems to be fairer to a lot of people, so you don't have these high premiums for people? This is part of the challenge and part of the failure of the way that Obamacare was architected. It's a tiny percentage of the population that has trouble getting covered because of pre-existing conditions, and this would actually cover them. But can we talk the politics for just a minute?
Yeah.
The reality that's going on is you've got people positioning themselves for their Senate runs, as in Michigan with Fred Upton, trying to look like they're the person who is tough on this, even though the bill already addresses this. And the real challenge that you've got is that Congress itself isn't covered by Obamacare. They got an exemption from the Obama administration in 2013. They're technically on it, but they get subsidies that would be illegal for anybody else. They get to remove much of their staff. And if Trump really wanted leverage, what he would do was he would announce that his administration was undoing that Office of Personnel Management ruling, and suddenly you would see that they would be singing a very different tune if it was their premiums unsubsidized that were so high.
I just want to add,
That's a great point. That's a great point.
4% of the population under the age of 65 would qualify under pre-existing conditions. And in the original pre-existing condition insurance plan under Obamacare, before the health care overhaul was completely rolled out, a little more than 100,000 people applied for that pre-existing conditions insurance plan. So it's roughly 100,000 people that we're talking about. So do you embed the cost in the premiums and the cost of health insurance for everybody, or do you get the taxpayers to fund it through these high-risk pools at the state level, if the states choose to do that?
But hopefully they will, because right now the current system is broken, it's suffocating, it's drowning, and what's happening now is the exact opposite to the correct solution in regards to serving our patients in this country. And patients want control over their bodies, they want control over their health care decisions, and they're delaying seeking medical care, which results in worse outcomes.
Yeah.
Patients are going to urgent care centers instead of the emergency room for severe life-threatening illnesses. I had a patient recently coming in with stroke-like symptoms. She had slurred speech and facial drooping and left-sided body weakness, and I said, look, I'm going to send you over to the hospital. We need to do a workup. The first thing out of her mouth was, doctor, how much is that going to cost?
Of course.
And that just broke my heart. So, you know, we definitely have to make some changes, because it's life-changing for many people right now.
Janette, thank you so much for weighing in. Really important insights from you. We appreciate it, Janette.
Sure.
Nesheiwat, Dr. Nesheiwat there.